was the one best lesson learned?
For me, just learning about Honduran culture is really, really interesting, and especially being in the healthcare field, you learn a lot about how culture and how political structures kind of affect the way things are done here, which is really different from the U.S., but it's really interesting and something that I really enjoy.
What was the most difficult thing you experienced?
The most difficult thing I think was just adjusting to life in Honduras. There's a lot of, I mean, people are worried about different things when they are in the U.S., so it's just kind of adjusting to what you should do, what you shouldn't do, in terms of just like communicating with someone, or also like if you should walk down the street, like with how much money, or you just have to learn to adjust to those things, and if you don't have someone there right away, you don't know. So just like the initial getting adjusted.
How was your host family experience?
My host family was really great. They told me several times they wanted me to feel like I was actually in a family, you know. So we got to celebrate the holidays with them, which was really nice, and they made sure that our food was always ready, like breakfast, lunch, and dinner was always provided, and it was always really good, and they would sit and talk with you, and they're just really nice people, so I felt right at home with them.
What will be your favorite memory?
I think my favorite memory will be of the people that I've met and the friends that I've made. I really like being able to meet people from different cultures and different backgrounds and share some similar interests or something and learn a lot. So I just think, sitting down with the doctors, the nurses, and learning about the country will be my fondest.
How would you rate your experience working with a broader view staff, both in the USA and in country?
I would say that abrupt youth got like a solid 10. On a scale of 1 to 10, they definitely got a 10. When we were in the United States, we would always get emails about what was due, what needed to be done, and they were very accommodating with housing, and just if I had any sort of question, they always got back to me really quickly and in a lot of detail. And they also just make sure that everything is covered. They pick you up from the airport, and then in country is really nice because we had Raphael take us places and tell us about what we should be doing, what we shouldn't be doing, and then he would also help us while we were in the hospital. If there was any sort of language barrier, he would help to make sure that we were doing what we wanted to do.
What was the one thing you wish you were prepared for?
I think, let's see what I wrote down. I wish I would have known how flexible the program is, because I would have taken more advantage of that, I think. You can really cater your experience to what interests you, so if you want to know about the organization of the hospital, you can look in the archives. If you want to work with patients that are dealing with HIV, there's an HIV clinic, there's maternity doctors, and they're all really helpful and all really willing to help you in your learning process. So I think I would have benefited from knowing that earlier.
Well, thank you so much for being a volunteer in the Brother View.
Thanks so much.